Hello and welcome to today's Talking Point presentation. Welcome to those of you in the room and to those of you online. I'd like to begin by acknowledging the traditional owners of the land on which we meet today and to pay my respect to the elders past, present and emerging, and I extend that respect to any Aboriginal and Torres Strait Islander people listening today or in the future. My name is Vic Manning. I'm the Head of Research and Workforce Development, and I'll be facilitating today's Talking Point, which is Building Recovery Capital, Translating Social Influence into Adolescent Addiction Recovery, presented by Dr Emily Hennesy. Talking Point is a regular series of publicly available lectures that aims to inspire, inform, and challenge our notions of what we know about addiction and its impact across society. And we really like our webinars to be as interactive as possible. So please ask questions via the Q&A function for those attending online, and those will be answered at the end by Emily. We'll probably go to those in the room initially and then over to you online. So this webinar is recorded and it will be available on the Turning Point website. So now I'd like to introduce Emily. So Dr. Emily Hennesy is an Associate Director and Director of Biostatistics at the Recovery Institute and an Assistant Professor at Harvard Medical School in Boston. Her research focuses on adolescent substance use disorder, prevention, treatment and recovery, and she's supported by a KO1, a Career Development Award from the NIAAA, the National Institute of Alcohol and Alcoholism in the US, which fellowship examines social networks and recovery capital mechanisms of the recovery process in adolescence using social identity mapping. She also advances evidence synthesis methods as an associate editor for the Campbell collaboration and serves on the editorial board of Psychological Bulletin. We're extremely excited to have Emily with us today, so please welcome her over.
Okay. Thank you, Vic, for that lovely introduction. Thank you for the invitation to be here. It is a real honor to be here. I should look. Am I okay? Close it. Okay. It's a real honor to be here. I was going back through my notes actually around the work that I'll be talking about today, and going back to some of the early articles that had inspired this work, and it was from some of the folks that are in this room who had actually kind of pioneered social identity mapping. So without those initial articles, I wouldn't be standing here talking to you today about this work. So I did want to acknowledge that because I got pretty excited. I'm kind of at the end of that Career Development Award, and it's exciting to share some of the findings with you all. So I do need to acknowledge the funders of the research. I'm not here on their behalf. I'm here talking about my own perspectives of the work, but I do need to acknowledge them as well. So to start, I do like to kind of give a few brief definitions of the concepts that I'll be talking about today. There are many definitions of recovery. I'm not going to say there's one right one, but the one that I tend to use is from the Substance Abuse and Mental Health Services Administration in the US, where they write about recovery as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And so something that's really important to me in this definition is it doesn't talk about abstinence or sobriety or anything about that. It really talks about what happens when an individual begins a recovery journey and sustains it. And you see all these wonderful things happen as a result of that. And this is a definition that is especially important when we're talking about adolescents who are typically between the ages of 11 and 19, because they're not necessarily focused on recovery from a substance perspective, but really on how recovery can help them live a better life. So some of the kind of key principles that are underlying all of my work in recovery, it's really important that we have this basic understanding that youth are not simply mini adults. It's a very unique developmental stage. So there's kind of these unique developmental considerations. And they need to be treated as their own people. They can be active partners in treatment and recovery. They should be active partners. Their perspectives should be incorporated. Oftentimes, they are using substances for a specific reason or many reasons. They may not be aware of those reasons initially, but having conversations with them about what substance use purpose, what that's serving in their lives is really an important starting point for their recovery journey. And so finding out what matters will happen by talking with them. Additionally, they're young people in a larger context that they may not have control over. They may not necessarily have chosen where to live, where to go to school, who their neighbors are, and all those things influence their recovery journey. And so it's really important to kind of think about them within this larger context in which they're kind of stuck within. So I talked a little bit about their unique developmental needs. This is a time when they're having a lot of changes developmentally in terms of their skills around self-regulation. They are really looking outward for approval. And so those social networks around them are going to be really important to understanding kind of any of their behaviors. During this time, they do have a heightened vulnerability to experimenting with substances. And because of where they are developmentally, that can also lead them to be have more problematic substance use more quickly. And what we know from adults that have experienced addiction and recovery is that that use oftentimes started during adolescence, during this experimental phase. The other piece about their social networks is that they are relying more on those peer social networks for support and approval. So they're looking to see what their peers, their friends, folks that are outside of their home environment are doing. And oftentimes those peer networks will reward more risky decisions. And so they'll be kind of rewarded for making risky decisions, for experimenting with substances. And so that can be a challenge when we're thinking about engaging them in addiction and recovery support services. But adolescents, as I mentioned, use substances for a lot of reasons. Not everybody who uses substances will end up with a substance use disorder. So it's important to kind of think through, why they started using and then why they continued using. Oftentimes it's initially, they start their use through experimentation or boredom, but it can be a result of being around other friends or peers who are using substances, having a family environment where there isn't an understanding of the danger of early substance use. And then some young people are also coping with mental health symptoms or other traumatic experiences. And so having a clear understanding of kind of why they initiated substance use and then also why they continued using is really important for this age group. And this is where Recovery Capital comes in. So Recovery Capital is a model that really situates an individual within their larger context. It's this idea that everyone has resources for recovery, and some people have more resources, some people have less resources, and there's a variety of ways that these resources can be generated. This is a concept that was developed in the 90s by two researchers who studied a group of middle-aged white males who essentially recovered without going to any sort of formal treatment. So these researchers sat down with and talked with these individuals and basically said, they have a high level of recovery capital because they had all these resources in their lives. That's why they didn't need treatment. And so an important question is, given that that was generated from this middle-aged white male sample, is recovery capital a construct that really holds up for other individuals who identify in different ways? And that's one of the things that my work has set out to do. One of the reasons that I got really excited about recovery capital is because it considers all the resources in someone's life, the resources someone holds themselves, holds in partnership through other individuals in their lives, and also have as a result of where they are in their community. And so a lot of my early work in this space sought to identify what are the unique sources of adolescent recovery capital, different from adults, different from that earlier sample of middle-aged white males. And this was an initial model attempt of kind of specifying the different domains of recovery capital for adolescents and what are some of the factors that might be part of those domains. And so similar to the initial models, we do have human capital, which is kind of that internal motivation, confidence for recovery, how they're doing in school, any sort of spirituality beliefs they might have. Financial recovery capital, which are those tangible assets and resources that young people have, most likely in relation to their family position. So as a result of their parent or caregiver resources. There's social recovery capital, so things as a result of their connections with others in their lives, just peers, friends, their family and home environment, and whether or not they have access to meaningful activities where they can do fun, sober things with other young people. And then within that, outside of that is a larger community and community recovery capital. And so communities that are set up for young people to recover successfully will have resources for those young people to engage in recovery supportive services. So a lot of my work has focused on examining kind of how effective community recovery capital settings are, what sorts of elements they have. I will get into a lot of that today because I'll really be focused on the social capital piece of things and where that lies in the young person's recovery journey. So to get to that point, I did want to give a little background on social influence and change and how it informs the research work that I've been doing. So essentially, we all divide the social world into categories, social categorization. You either feel like you belong to a group or you see another group as an other. So you're always kind of engaging in some social comparison. This is true for adolescents. It's true for all of us here today. You come into a room and you see, are these people like me? And if I feel like that we're similar, then I want to act in ways that the group would approve. So obviously you all are sitting in front of me, you're sitting there politely, no one's jumping around, you're engaging in the way that you think the group is going to want you to engage. And that's wonderful and respectful, but it's also part of the larger kind of social theory context. And so young people are very similar in that sense. And oftentimes they are looking to develop their own social identity because it can serve some basic developmental needs when you feel that belonging, engage positively with others, and you have this increased self-esteem. What's slightly different about young people is that is that they are it's a little bit easier for them to kind of experiment with social identities. Their social identity isn't necessarily set. So they can kind of try on identities like you would a pair of shoes, essentially. And they can be one person with one group, be another person with another group, and they don't necessarily feel like that's in conflict too much. It's a little bit easier for them than it would be for adults. Maybe you think about, or at least I can give myself as an example, I think about myself as a mom, as a researcher, as a few things, and those are my set identities, right? Young people, it's a lot different in the sense that they can try those identities on a little bit differently. And so there's been a lot of work around the influence of different groups in a young person's kind of initiation of substance use and also in their recovery process. And it kind of aligns with what we would think about conceptually. If you're around other young people that are using substances, you're probably going to be using substances with them if you feel like you want to be part of their group. And if you're able to engage with other young people that aren't using substances that value recovery, then you're going to, kind of lessen your substance use. And so there's a lot of research that kind of demonstrates that those relationships are present in the way that we think they would be. And so this brings me to social network transition. This is some initial models by David Best and others, as well as Kate Monahan, that really talk about what happens to a person's social identity during a recovery process. And so it's important to remember this all kind of happens within the larger context of recovery capital, those resources for recovery, as well as barriers to recovery. But the social identity network transition model essentially says that when an individual is actively using substances before they enter recovery, they have several, maybe one, maybe more groups, but at least one that's using substances. And that group is going to exert a heavy influence on their day-to-day behaviors. They're going to feel very aligned with that group. So they may have other groups in their lives that aren't using substances that are part of their experience, but they're really going to think about them as belonging to the using group. What's been proposed is that through the recovery journey, as someone gets engaged with treatment and recovery support service groups, they begin to add new groups to their social network. And that using group, while it's still there, maybe still a part of their life, is not going to exert as much of an influence as it once did when they were actively using. And so the idea then is as they progress during their recovery, they will start to kind of align more with the non-using or recovery groups, and that using group may still be part of their network, but won't exert as much of an influence. The challenge with this model is that it really focuses on the substance use or non-use of the groups that are around them and kind of neglects to consider other reasons or other identities that may be built in to groups that someone is engaged with. So for example, a young person may really love sports and have a great sporting group network that also has a lot of alcohol use that's built into the norms of that group. And so they think of themselves as a person that is affiliated with sports primarily and don't necessarily think about the substance use piece of that comes along with it. And so the theory is helpful in thinking through the social network change over time during recovery, but it might lack kind of that nuance of the different reasons why a young person is engaged with groups and hanging out with them, but also maybe being put at risk. And so some of my more recent work really has sought to think through what are the different ways that social groups can be supportive. And oftentimes we think about this as kind of a black or white, right? A group is either supportive or not supportive of your recovery. They're either using or not, right? That very simple dichotomy. But in work that I was part of with Dr. Sam Mizell, we really tried to think about, what are the different ways that social recovery capital, that influence on recovery, how can we measure it, and how can we think about these different influences for a person? So if we look at the figure, sorry, am I able to minimize this because it's in the way of the slides?
Yeah, just that.
This? Yeah. Okay, cool. Move that out of the way. Yeah. And so here, if you think about measuring social recovery capital, for example, and you get the summary score, this is your social recovery capital score, right? This one number. What can happen is if you neglect kind of the different aspects of social recovery capital and how that makes up that score, you could think someone has a great recovery capital score because they're really strong in one domain of social recovery capital, but actually they have all these risks that are kind of part of their network. And so, for example, you see this line here, they have few friends who use substances and a lot of friends who do not use substances. They also have supportive friends. But then they have a lot of family members who use substances. So they're getting different degrees of risk and influence depending on which group that they're a part of or hanging out with in their lives. And so it presents a really complex picture of social recovery capital that's worth kind of exploring in a much deeper way, especially when we consider the importance of social influence in recovery. Now I've lost there we go. So that brings me to how we measure and examine social influence in recovery. And here's where social identity mapping comes in. And this is where I was saying some of my early thoughts around this were really generated by some of the people that are in this room. When I wanted to set out to understand a young person's recovery journey from a social perspective, I had a few options of very long, very boring measures that go through every single person in a young person's life and the degree to which they use or don't use substances and how supportive or unsupportive they are. And long, boring, lots of questions that provide really rich research data, but at the end of the day are difficult to implement. And, a young person can walk away feeling like that was not so much fun and pretty overwhelming. So I came across social identity mapping and just really got very excited about the idea. As you can see here, it's very visual. But for those of you who are researchers, you also get quite a bit of numeric data from this information. So a social identity map is a visual map of a young person's network or a person's network. And each Post-it note represents a unique group in their life, and they get to choose what groups they put on this map. And so in this example, we have a family, close friends, work, drug friends, and recovery group. The size of the Post-it note represents the importance of the group to the individual. So we can see here that family is considered most important, whereas right now this person says their drug friends are least important, with some of the other groups kind of mixed in between there. We also can capture the number of days that they spend with that group, and the person can indicate the level of identification with that group on a simple 1 to 7 numeric scale on the right-hand corner of the Post-it. This is all kind of around, they place these names around themselves in the middle. So they really do kind of get the sense of like, this is my life. These are the groups that are with me or I'm interacting with. The jagged or squiggly lines represent the level of conflict between groups and each other and groups and the person. And then the blue and green lines represent a degree of commonality between the person and their groups and the groups and each other. And then additionally, what we have here are the substance use level of each individual group member that this person considers part of their lives. And so when I first came upon this map, we did make some adaptations so that we could use it pretty easily for research. But essentially what we see here is this person has 4 members of their family group, each with different levels of alcohol and other drug use. And so you get a really clear picture of kind of where there might be some supports in their life or where there might be some barriers. And so because this work was funded by the National Institutes of Alcohol Abuse and Alcoholism, we did want to separate kind of alcohol use out from other drug use. And that's why the large dots represent alcohol and the little dots represent other drug use. And so when I came across this map, I had seen it for adults, and then also there had been one study that was conducted with younger people. But I really wanted to see, is this a viable method to kind of standardize and use with young people in recovery kind of anywhere? and how can we make sure that they actually understand what we're asking them when we're asking them to complete this map. So that was some of my initial work in two studies that I'm going to be talking with you about today. So study one, I had a really small sample of young people ages 12 to 19. They were either in treatment, seeking treatment, or in a recovery support service group. And essentially, we asked them to do a single study visit that included the social identity mapping, a post-mapping interview, and a brief survey. We launched this during the COVID pandemic, so that made it a little challenging for the mapping. We were able to do some in person, but we primarily did remote study visits with the sample. And if they were remote, we actually mailed them the materials to create the map. And then we, would set up a time and do the mapping with them. And so the focus of that work was really we had this initial kind of draft guide that we would walk people through to see, like, are these instructions clear? Can you create a map? And then as part of the post-session interview, really asking them, when we asked you to indicate how much a group was important to you, what kinds of things came to mind? What did you think was kind of driving that rating? When we asked you about conflict, how did you rate it if the conflict was like high or low or kind of medium conflict? And so we got the social identity maps from them as a result of that. So anyone could keep their map, and then we would just take a picture of it and save it for our records, because we felt it was really important that they get to keep the product of their own work, which is another thing that we really like about social identity mapping, because oftentimes we're asking people a ton of questions on surveys and they don't actually get to see their results at all. And this way we said, you can keep this, you can get rid of it, you can share it with somebody, it's yours, you've created it. So that was the first study that I'll be sharing some findings from. The second study is a much larger study. It happened after that initial adaptation and piloting study. And we're just kind of finishing up the year-long longitudinal visits now. We recruited 200 young people who were entering inpatient treatment. And then we had 4 study visits with them, 1 when they were entering treatment, 1 at discharge, and then 1 3, 6, and 12 months after discharge. And so we did the mapping process at kind of when they entered treatment, or within a few weeks of entry to treatment, and then again at the 3, 6, and 12 months after their treatment discharge. In addition to that, we did have structured clinical interviews, self-report surveys, and then we have a subset that we're doing some qualitative interviews as well. And these were initially kind of baseline study visits in person, and then most of the follow-up visits are remote. So we use the online social identity mapping tool for that, which I'll talk about in a second. So the first study, this is just an example of what an actual map would look like. This is where we got a chance to kind of play around with the visualization, but I just wanted to kind of show what a final real life map would look like, and how kind of visually appealing it is. And a lot of the young people, when we were doing the follow-up interviews with them, just would respond and say, this was like a fun activity. It's really neat to see kind of what's going on in my life in this way. Some young people said, I knew this, but I didn't really understand it until I can see it here in front of me. And so that's an example of that kind of by hand visual map in front of you. And I'll show the other example in a little bit. So in terms of the different level of information that we got from each of these maps, we were able to get quite a bit of different kinds of information. So we looked at kind of the different types of groups that young people reported, and found, primarily they would most often report at least one family and at least one friend group. A lot of young people, though, also had a treatment group on their map, which is interesting because they had just kind of entered treatment, or were within typically a week or 2 of entering treatment. So the fact that they thought that group was an important part of their life says something about kind of what the treatment was doing to start to shift their social network. And they would also have a recovery support service peer group on their map. Some young people still had a work group on their map, and some young people had kind of school groups on their map. And there were a few young people, very few, that had a religious group. And then some young people also had a pets group on their map, which can't really analyze the social influence of pets. But I think important to acknowledge, the importance of kind of these non-human groups in their lives, and kind of the relief that the pet groups gave them. So we, when they would ask questions about if that was okay, we said, sure, it's, kind of whoever you want to be on your map, you can put on your map. And so this is the results of kind of initial analysis from the baseline data of 108 young people. We can also see here is that young people most often had the highest range of friend groups. So they had a lot of friend groups, fewer family groups as you would expect, and then much fewer treatment and kind of recovery support service groups. So this is some unpublished data. So we did, because we're collecting the level of alcohol and drug use among the groups that are part of their lives, what we found was 30% had no heavy use groups in their networks, which means that the majority did have at least one heavy substance using group in their life, with approximately 25% having two or more heavy use groups. And then there was about a quarter that had no recovery groups in their life. Even though they were part of a treatment network, they were still kind of saying, well, that's not really part of my social identity map. When we looked at relationships between the type of group and the level of alcohol or other substance use, we found that those with more recovery groups actually had 3 fewer days of alcohol use than those with no recovery groups. Those with heavy substance use groups had 11 more days of marijuana use and 7 more days of other drug use than youth without any heavy substance use groups. So you can really start to see that, strong connection there. And those with no heavy use groups, or at least one recovery group, had higher recovery capital compared to young people who had at least one heavy use group or no recovery groups. So some kind of initial descriptive relationships around, how the use of groups actually does relate to recovery capital and substance using behaviors. When we were asking them questions about how this group supports your recovery, I'm going to focus here on some kind of mixed and unsupportive groups. So some of them said, I have this particular group is not supportive because they want to see me continue to use, as they see me as more fun when I use. And they say, I don't get much support from using friends. They often try to get me to use. So they were answering that about specific groups that were on their map. But then they also had kind of responses around the mixed supportiveness of relationships, or kind of this dual influence, which really speaks to the nuances of these social groups. So they say, people I can trust and love, but I know for the better I can't be around them or I'll use again. I've made many friends by using, and it's hard to let go of the drug, but also the friends. They respect my boundaries, but talk about using frequently. And this has come up actually in some of my other interviews with young people, where they feel like they almost, like no one's pushing them into using substances again, but they don't necessarily understand how difficult it can be to be around the substances. I had one young person who, everyone in her family kind of used alcohol. And she said, we have these parties and there's alcohol there, and I'm just supposed to pretend like I don't have a problem with alcohol because it's, they can all use it, but I can't. And so you see where they have, strong relationships with individuals or groups, or they're kind of forced to be with groups because of their family dynamics. And yet there's the risk and the barrier of the substance use that's happening around them. And then we had another young person who say, they want me to smoke sometimes, but are okay with me being sober and provide support. And so there's a sense of like, some groups are not all bad and some groups provide mixed support. And how do we support those young people when they're in those kind of mixed supportive relationships? The other thing that was really strong kind of in the findings from this group was the level of conflict among the groups. So on average, they had about like 1 high conflict group in their social networks, 2 moderate conflict, and 2 to 3 low conflict groups. And females tended to report slightly more high conflict groups. In this study, in an earlier study I had done, more high conflict was also associated with lower recovery capital. And more low conflict groups was associated with higher recovery capital. And so conflict is something that kind of is written about, especially in some of the relationship dynamic literature, but not necessarily linked to recovery and substance use in this way for young people. And so this is an area that we want to explore further in the future around, what those conflicts actually look like and how they might affect the recovery process. The other thing that came forward was really, belonging, connection with recovery supportive groups. And so there were lots of quotes for specific groups around how a group specifically helped them and were supportive of their recovery. So this one young person says, my college friends, they encourage me to be the best version of myself and work hard. And they also make me really excited about next year. We also see, another group, they pressure me to not smoke while encouraging me to do activities to boost my mood. Together, we find other ways to keep me busy and occupied. And another young person says, they let me talk to them about recovery and actually help me be something about what I'm comfortable with being around, never complaining or seeming upset if they can't use around me. And so what we tried to do with these interviews is really get a sense of like, yes, if you say a group is supportive of your recovery, like what does that actually mean for you? Like how is that operationalized? Because if we know specific ways that different groups can support a young person, then we can try to build that into some of the treatment and recovery support services, especially on the family-oriented services, really thinking through what are ways that families can actually be supportive versus kind of getting in the way of the recovery journey. And the last quote here was from a young person who said, I usually go to the addicts or my sober friends because I can tell them anything in the whole world and they won't say a single thing and be like, get out of here. And so this quote was really important to me. And this interview actually with this young person was really important to me because it said something about the value of the groups that are still using substances for this young person. He felt a really strong connection with folks who were still using substances because they had these shared experiences and they understood the barriers and the challenges that they'd had in their lives. And this young person, he had actually had a girlfriend who had ended up passing away from a drug overdose. And he felt like it was only really the other addicts that were in his life. And that was a term he used. So I'll use it here. But he really felt like he still felt the belonging with them because they didn't blame the overdose on the girlfriend. They understood that she had had a problem and that was a consequence of the problem and were really supportive in that sense. And so he definitely really struggled with that because he said, I know that they may not be the best people for me to be around for my recovery, but I still feel a sense of belonging and companionship. And how do I get that from other people who haven't had this experience? So it's an important kind of way to think about social groups and how we structure them for young people if we're still trying to help them feel like they belong when they're going through the recovery process. And so the last theme that I want to talk about is kind of social identity and stigma. And this came out of some of the initial qualitative interviews that we did with young people. We did not ask directly about stigma or really go down that road, but it kind of emerged directly in the interviews. And so we ended up adding some questions about how they talk about their recovery, terms that they like to use for their recovery, and what happens, kind of what happens when people find out about their recovery journey and they weren't the ones to tell them. And so we had these three themes. This was work that an undergraduate honors thesis student had done as part of her thesis project. So we worked on this together, Sophia Blythe. And so essentially we really kind of took a deep dive in this area of disclosure. And so oftentimes, unlike adults, adolescents don't have the option to choose who to tell or not to tell. It's often kind of somebody tells other people for them. And so most often we found that young people experience unintentional disclosure, like their parents tell their friends, tell their school, who tell other people. And so that when they return to that space, they feel quite a bit of stigma. They oftentimes don't know kind of how to handle those conversations, especially if they feel like everyone's kind of watching or judging them. There were some positive instances where they got to choose who to tell, and they felt like that was a really valuable experience. And they would talk about, if I could tell people, it would be my close friends or these recovery groups, maybe some immediate family, definitely not coworkers. Most of the young people I talked with were very candid that, coworkers do not need to know. Some of the young people that were going on to college or university after they graduated high school had said, I'm not going to bring that with me into my next kind of experience. I don't need to tell them. They don't need to know. And so there was this real sense of understanding around their own agency and when they didn't have that agency, when it was taken away around those conversations. And that kind of resulted in how they experienced life after the disclosure. And so for some, they felt supported by family or close friends, but they also felt the sense of kind of being watched over and like having friends or family that didn't really know how to deal with them now that they knew about this challenge. And so it's definitely an area for kind of programming and intervention to really work with. Okay, how can you interact in the world when you've had this unintended disclosure, and how do you kind of handle that? Some young people did talk about stigmatizing interactions where they felt directly stigmatized or perceived that they would be, but then a lot of young people really demonstrated a resilience and kind of would say, they're going to think what they're going to think, but I'm myself and I feel good about where I am today. What we also saw in this group was really a mixture. Some young people felt really strongly about their preferred terminology, about how they wanted to talk about having a recovery journey. And some really had very strong feelings around how they didn't want to be talked about. And it was kind of a mix of things. So some young people were like, yeah, you can call me an addict. That's what I was. But what we found was really they were maybe fine referring to themselves in that way. But if they're being talked about by another person, that was where there was kind of that line drawn. And so for us, kind of the underlying takeaway message is, talk to a young person, see how they want to talk about the recovery, and then use the language with them that they're comfortable with using. And let's not assume anything because there doesn't seem to be one right way to talk with them about their experience. And so the last piece of this, I did want to show a little bit of longitudinal data since we have it. We use the online social identity mapping, which is set up by the University of Queensland here in Australia, which is really fun to kind of collaborate with Sarah Bentley and develop an online version of social identity mapping that was able to capture some of the substance use. And so I did just want to show this is one young person from their baseline to their 3-month follow-up. So the colors of the groups change depending on the substance use level of the group, kind of similar to the by hand version with those little member substance use sticker dots. But essentially what we see here is the reds and the yellows indicate heavy or casual use, whereas the blue indicates non-use, and then the green indicates recovery. And so what's really positive is that you can see in this young person's life, we do see quite a difference from their kind of initial baseline where they're entering treatment and they're kind of thinking back to the groups that are part of their lives before treatment to 3 months after treatment where they have these different recovery oriented groups in their lives. And they still have a group that's heavily using substances, but they've kind of surrounded themselves with a lot of other recovery supportive groups. And across the sample subset of 60 participants who we've been able to look at so far, that pattern kind of emerges where we see on the left here, we see a lot of heavy using substance group in terms of friends in their lives, whereas at 3 months, that number is reduced by about half. There's still some more casual substance using groups, but we also see this increase in treatment and recovery supportive groups. And interestingly, too, if you go to the kind of middle bars, we can see their treatment peers at baseline of those who reported a treatment peer group. We can essentially see what happens at 3 months is they don't have those groups in their lives anymore, which they've left treatment, so maybe they've disconnected from those treatment groups, which is not so surprising. And it's something that I've heard in a lot of interviews. Young people will go to treatment and then kind of leave treatment and leave those treatment groups behind. But we do see this increase in recovery supportive peer groups at the 3-month mark across the sample of young people, which is really positive. So it suggests that essentially, even though they're leaving behind some of their treatment peers, they're engaging in groups with groups in the community that are supportive of their recovery. So some kind of conceptual takeaways was really the importance of being able to see their network, having that visual map, as I was saying, versus having the survey data where you ask them a bunch of questions and you take that data away. Them being able to see it was really helpful and important for their own recovery journey. They also often kind of, when we were talking with them about their maps, really reflected that they liked to see the progress that they'd made in their recovery journey. And felt really good about that progress because they could say, I've done some active steps to get where I am today. And this, one young person even reflects, I may have some bad apples, but the good support that I have completely outweighs the bad support. I have a good support group is what I learned through the mapping activity. And so we have had quite a few young people request to have them kind of compiled over time from this longitudinal study. And so what we've done now is at the end of the study, we mail them a copy and email them a copy of all their maps kind of on one page so that they can see the change that they made over time. And so what I am doing now is really developing this approach into a youth-friendly intervention module. We just got some recent funding to do that, to essentially in addition to having the social identity map as a data collection tool, to have it be a way to kind of a standardized intervention approach with the treatment provider that they could, sit down, do the mapping, and then have a conversation about it afterwards to kind of generate some initial insight and potential reflective change. And so the last thing I did want to talk about is really thinking through. So one of the kind of underlying areas of my research is that idea of the overall context, right? An individual is not just recovering on their own by themselves, but really in community. And how can we do that in communities? How can we create better community programming for individuals in recovery in general, but specifically young people? And so a lot of the programs that I've studied in the US, when they're community-based programs, they say, our goal is to enhance the sober supportive networks of people that are engaged in our services. We try to connect you with other people. You have these good social connections, and it helps you in your recovery. But nobody's really measuring whether or not they're doing that successfully. So that is one area that I wanted to dive into a little bit more. And so essentially, we know there's a lot of programs that can help kind of build social recovery capital through community programming that can help reduce that stigma and support recovery. And there's a bunch of them for adults, which I've listed here kind of in the top in black. And on the bottom, we have several recent systematic reviews that we've published around some of those programs. So if you're interested, you can scan the QR code, get access to those. But the three that I've really focused on in my own work are specific to young people. So recovery high schools, which are high schools for young people who are in or seeking recovery. Collegiate recovery programs, which are recovery supportive programs on college campuses, college and university campuses. And then alternative peer groups, which are groups for young people to build positive social connections during their free time after school or on the weekends. And I did want to talk a little bit about those, although I'm probably running out of time, so I will make it make it pretty quick. So one of the underlying kind of theoretical frameworks around why social groups are so important comes from the concept of G-chime, which is kind of considered to be maybe an engine of recovery, with the idea being that initial connection in someone's recovery journey is really what can kind of fuel that journey. So getting connected with others outside of yourself is like that kick-starting point. And once you have that fuel and you're connected with that group, you begin to see hope through engaging with other people that are like you or similar to you. And you can see people that have continued in their recovery and feel really positive about that. And that creates a cycle of meaning, empowerment, and identity that is kind of it's self-generative, and it enhances as you kind of continue in that journey. And throughout that process, what the G-chime model suggests is that you really need to have an open, flexible mindset that enables you to continue to grow and develop in your recovery journey. And so thinking about that and social influence and connection, we took that kind of initial model that was proposed by Dr. Leamy and really said, okay, so if this is kind of the underlying theory, does this happen in a recovery program context? And so we had qualitative interviews from young people who were part of alternative peer groups during their adolescence, and they were reflecting back on that experience during young adulthood. And so we analyzed data from those young people who had participated in the groups and then with leaders of those alternative peer groups as well. And so what we found essentially from analyzing those interviews is strong evidence that the G-chime model is kind of how that program was operating. Because it created that initial connectedness with young people, they felt it kind of generated the cycle of hope, identity, meaning, and empowerment. And so that was really key for most young people. However, some young people didn't talk about the connectedness at all. They didn't really care about the social programming, and they really focused on their own motivation for recovery and what they brought to the table. And the connectedness piece was kind of like secondhand. It was a program that they had to do because their parents wanted them there. They didn't really care about it, but they talked about what was in it for them and how that motivation, that self-driving motivation, was really important for their recovery journey. And so essentially, to close, kind of with that brief preview of research, again, recovery kind of happens in community. Oftentimes it's not within a treatment program, although that can be where it starts. So we really need to think about the recovery context that a young person is going back to when they're out of treatment and how we can support them. Youth during this recovery process tend to report many relationships with individuals who use substances in their social groups, and that includes with their family groups. In this sample, we actually saw quite a high prevalence of young people who had family members that were heavily or casually using alcohol and other drugs. And so that's a huge potential barrier for them if that's a home environment that they cannot escape from. Yet, they also reported relationships with individuals who are not using substances, who are in recovery. They rated those relationships as really important, and they strongly identified with those. So we see this mix of kind of support and barrier in their social networks. As I mentioned, conflict was highly present throughout the relationships, different sources and kind of types of conflict, which is important to consider when thinking about how to address the social network of young people in recovery. And so what we found through the interviews and through engaging and doing the social identity mapping is that it was a useful tool for understanding the recovery process. Young people tended to enjoy it. It was visual. They talked about it being fun or not as boring as they thought it would be, which when you're working with adolescents is a real win. And so as a result of some of the qualitative work, really thinking through how it could be useful to use social identity mapping to start to intervene in the recovery process, because it seemed to promote the development of insight for some young people. And the other thing is, it's hard to generate social network change on your own. So it may only be possible for young people in recovery through linking them to new social opportunities. And for those organizations that are doing that are responsible for that, wouldn't it be great if they were actually able to measure that they were doing that they were able to influence the recovery process in that way? And so SIM could be a great tool for that. So thank you all for your time. I'm going to say this is an event, so if you're interested in purchasing the Handbook of Recovery Capital, I have a discount code there, but I'm also happy to share a piece of that book with you as well. So thank you all.
Thank you so much, Emily. That was wonderful. I think such a fantastic overview of the theory, recovery capital, social identity, and you've done such an excellent job of really, I guess, hitting home why we must not just assume we can take what the evidence and what works with adults, and the nuance of applying it to youth, and the sort of connectedness as a catalyst for the CHIME outcome. So we will take some questions in the room first. I'm just going to move to the Q&A. Do we have any in the room before we go to those online? Yeah, there's one over there.
This is such a fantastic talk, Emily. Really taking the whole idea of adolescence also as changing identities, it goes very easily and fluidly, and wondering how you would deal with that in the social identity mapping process, that dynamism, that flux between different groups and different identities.
Yeah, it's a really good question, and something that I kind of struggled with in examining the data, because so they're able to rate their level of identification with each of the groups in the map. And so what I thought about is, okay, if it's a family group, and I'm you're analyzing the analysis of their level of identification with their family group, but then it's also a heavy substance using family group, right? And so how do you kind of handle that interaction? And so what I started to do is really tease out kind of looking at those separately. So just looking at the identification with heavy substance using groups versus, casual versus recovery groups. And then looking at, okay, how is that different from their level of identification with the type of group that it is? Depending on the sample size, you could look at those kind of interactions, but it's a bit of a challenge. So what we have found initially is that young people tend to be heavily, at least young people in treatment, their level of identification with their treatment and recovery support groups actually is nearly similar to their level of identification with their friend groups, which we're assuming are kind of out of recovery or out of that treatment space. And so looking at that over time and to see, does it shift over time for them? And that's kind of the planned analysis down the line. But when you start to look at all the different ways you could look at this together, it becomes quite complicated. So yeah, open to ideas too.
Cool, did you have a question? Oh.
How does social class sort of fit into that social capital component?
Yeah, it's a good question, kind of from the theory perspective or from the mapping perspective. Yeah, so we haven't measured, we don't have great measures of social class in the survey, in the data set. So we couldn't look at that probably directly. But I can imagine, I can imagine a couple ways around it, but if we're looking at the social groups that they're reporting, to some extent, if it's a high level identification, you would think they similar kind of social class, and maybe lower level of identification could be different social class, but could also be kind of different contexts. So a lot of young people, if they have a work group on their map, they're not very highly identified with that group. But it would be worth kind of teasing out in some of the interviews that we do and kind of getting a sense of, okay, you have 3 friend groups here. This one you're strongly identified with. This one not so much, like kind of talk through those reasons to kind of get at that sense of maybe social class plays a role in that.
Great presentation, Emily. That was wonderful. I was just wondering about, I guess, you mentioned about stigma and kind of thinking about, I guess, whether there's a potential kind of this activity mapping to kind of create this kind of binary or like consider substance use in kind of potentially inadvertently stigmatizing ways as, not so positive or positive when I think you alluded to the complexity that, people find friendships and connections with people who may or may not use as kind of meaningful or not. So I wonder if there's a kind of, if that's something you've considered or kind of thought about how to work around.
Yeah, I think so. When we were first piloting this with young people, in that first study of 28, we had given them an example map that was from like the published article on social identity mapping and addiction recovery. And one of the groups on there was like a drug using friends, and then one was a recovery friends. And we did find that, the young people tended to kind of use those labels. And so we a few maps in, we're like, we need to not give them that example map. That's not not good to do. And so we did end up kind of starting to just collect names of groups. And then because some young people also were like, what should I be thinking about here? And so we tried to give them some examples, but then we had this list and it was like, these are all the different ways that you could think or talk about your groups. So we tried to avoid it in the naming that way. And what we found with the online social identity mapping, since they don't actually get an example map, they're just kind of walk through how to create one. They're still actually using like drug using group labels and things like that, which is kind of an interesting dynamic. When you saw that one map that had like normie friends on it. So and they're in treatment. So this is a very severely affected sample. So I didn't get into some of the background characteristics, but oftentimes this is not their first treatment episode. So I think they're kind of in that language of how a lot of people kind of think and talk about substance use and recovery. But it is something that we've tried to counter in how we set up the design of it. And yeah, I'd love to, in some of the interviews, to talk with them. Okay, like why did you use these labels, right? And do a deeper digging there. Thank you.
I was wondering about the 2 things, the conflict. Did you get a sense of if that's conflict at home with parents or more, influential conflict with peers?
We did, when we were initially having them kind of do the conflict lines, we had some question, a lot of young people like, well, like what should I consider high conflict? And we kind of just asked them, what would you consider high conflict? And what would you, and so they started to say, low conflict is kind of everyday stuff. You're kind of annoyed with someone, whereas high conflict would be like beefs with other people, like that, or like fights or things. And because they were drawing the conflict lines between the groups, we also asked some questions of like, well, what does this, high family conflict mean versus like, what is this kind of friend family conflict? And if there was family and friend conflict aligned between those groups, it would often just kind of come up in the interview as like, well, my parents don't really like that I'm friends with these people still, and that's kind of what causes. Yeah,
makes sense. And can you tell us any of the strategies that are successful or effective in getting people to sort of other peer groups, community? Have you got a sense of what works? Because I can imagine it would be quite hard on occasions to convince somebody, no, don't go hang out with your friends who are drinking or using drugs. This is other community group, and how confident would they be to go along? So I was just wondering how you get them there.
It's really hard.
Very hard.
I think about myself, it's like if somebody told me to drop this group of friends, like, okay, what do you want me to do? Like, who am I going to hang out with?
Yeah.
And it's the same for young people. And so I think that's actually one of the reasons why the alternative peer group model has kind of taken off in the United States. The other thing, and this is challenging to think about from like a youth empowerment perspective, but oftentimes young people would say, my parents made me go here, or I was court ordered to go here, and I didn't want to do it. But because I had to go and I was there and I actually started to have fun, then I started to feel belonging and started to shift, right? But it was that initial piece of like, there was some degree of coercion because they had to do it. And then they started to kind of align. So it is this tricky balance, because you want people to make those choices, but then you want to help them have that opportunity. So
fantastic. Yeah. No questions online. So are there any more in the room? Oh yeah.
Thanks, Emily. I was just really curious with what you mentioned, sort of adapting it for an intervention. Like, what do you kind of see as the key elements or differences there in using it that way?
So what I'm thinking is it would still, and this is what I'm going to start talking to clinicians about, but essentially it would still be the initial mapping where they kind of create the map and they're doing putting all the elements on paper. And then really what we've started to do just in the interviews that are part of the data collection is just have them sit back and just reflect on their map. And that's really started to generate some really lovely insights from young people themselves. And so I envision that the intervention would be something similar, but with a clinician experience in motivational interviewing that could essentially kind of ask the right kind of questions to get them to kind of start to self-reflect and kind of identify some areas for change. And we saw some of that. So I had to be careful because I was doing this as a tool for data collection, not an intervention. But I did start to see some of that with some of the young people of like, oh, well, maybe I should start to do this, or maybe, really kind of starting to self-identify like, this group actually is really difficult for my recovery. And one young person was like, I've been going to church. I'm not religious. I don't even like church, but I know I'm not going to be off for drugs there. So here, this is my attempt. Right. And so, young people are very smart. And so it's oftentimes just giving them the tool and the space to be self-reflective. And I think the visual piece also, because with the by hand version, you have them place each of the groups, and then they have to place a sticker dot for each member of each group. And they have to really think through, okay, red means heavy use, and that's this person. And they're doing that, and it takes a little bit of time, but kind of the process of doing that and the time that it takes, it begins to cement something, I think, in their minds where they are like kind of prompted to just self-reflect on what that might mean for their recovery. And so then I think an experienced clinician could essentially kind of use that and really guide them through a process of thinking through change and kind of steps within a larger approach to treatment. Yeah. Hopefully it will work.
I mean, it's such a useful tool for that, I think. Yeah, very intuitive. All right. Oh, one more. Great.
Yeah, I'm similar to Michael's question, because obviously all the groups like the work group and the sport group and then the usage group are all like separated.
Yep.
How often did you find, like I'm thinking in the Australian context, if you're in a sports group, that's almost always going to mean like exposure to alcohol and gambling. So like, how often did you see like those groups potentially have like a healthy behavior, but also an unhealthy behavior within the same social circle?
It seemed to be, I had several young people, many young people would talk about like, they're using, but also I feel really connected, or like, I hang out with them the most, but that's not because they use, just because I have the most fun with them. And so there is that kind of dual nature of risk and support or influence that I think is really hard to tease out. And I had another thought, but I've lost it. I'm going to blame it on jet lag. So sorry. Happy to follow up.
It's a legitimate excuse. Yeah. Okay. Well, we're going to have to wrap it up there because we're at 2:00. So please join me in thanking Emily for fantastic